EOL, 4th of August 2023, the lesser-known accounts of China's collaboration with Africa on health. China has been attempting to win over the hearts and minds of Africans, steadily converting to Chinese culture. Chinese cardiology expert Mei Gengnian was laid to rest in a remote mountain town in Jimma, southwest Ethiopia. On his busiest day, Dr. Mei, who led China's first medical mission to Ethiopia in 1974, saw more than 300 patients and carried out 7 procedures. 1.5 years later, the Chinese doctor's voyage to Africa ended abruptly when he passed away in a horrific car accident after finishing his medical consultations in a disaster-stricken region. But his son, Mei Xueqian, who traveled to Africa in 1998 with another Chinese medical team and again made its way to Ethiopia, picked up the mantle. We glimpse China's extensive medical aid and health collaboration with Africa through the narrative of Dr. Mei and his kid. The first Chinese medical team left Beijing in 1963, traveled through 3 nations, and arrived in Algeria 10 days later. China has dispatched more than 22,000 medical professionals to Africa in the 6 decades since, helping more than 220 million people in more than 50 African nations with diagnoses and treatments. Global accounts of Africa's progress frequently emphasize the economic side while undervaluing the social side, particularly public health. However, Africa, which has the highest concentration of developing nations, is adamant about modernizing its public health system, which is one of the goals of the continent's Agenda 2063. For it to happen, several barriers still need to be resolved, including those relating to professional skills, infrastructure development, and disease preparedness. China's help and collaboration with Africa on public health might be seen in this context. China began by sending medical teams but has now expanded as it shares the knowledge it has acquired through modernizing its public health system. Building capacity is where this all begins. The Africa Health Strategy, AHS 2016-2030 lists 2 strategic priorities: human resource management and health research. China has provided medical training in various ways to satisfy this requirement, including clinical teaching, surgical demonstration, academic lectures, online courses, and training programs within China. Zambian doctors independently performed endoscopic pituitary tumor surgery through the nose for the first time in February of this year after receiving training from China's 23rd medical mission to the nation. Previously, this procedure was thought to be so tricky that Zambians had to spend a sizable portion of their savings and travel abroad for it. Sharing best practices in diagnosis and treatment complements practical training. For instance, traditional medicine is a subject of long-standing cooperation between South Africa and China, with the former using it to enhance health conditions in rural regions. A significant component of China's collaboration with Africa is its support for the continent's health infrastructure. The African Development Bank identified significant and varied health infrastructure needs due to the expanding population on the continent in the Strategy for Quality Health Infrastructure in Africa 2022-2030. China accepted the challenge with its internationally praised infrastructure building efficiency. One example is the 2013 commissioned Nigeria-China Friendship Hospital. With grants of medical equipment to this healthcare institution, the hospital was constructed in under 22 months for a total cost of approximately $12 million. When the COVID outbreak was at its worst, China assisted in designing, constructing, and delivering Nigeria's largest makeshift hospital in less than a month. China has contributed to constructing more than 130 hospitals and clinics across the continent, enhancing local access to medical facilities. Cooperation is also becoming more focused on illness prevention. The most economical method to lessen the demands on the health system is through prevention, as is made evident in the AHS. An excellent illustration is the 100-bed diagnosis and treatment facility in Liberia that China built during the Ebola outbreak and was intended for quick virus identification. The headquarters of the African Centers for Disease Control and Prevention, CDC, whose first phase was inaugurated earlier this year, serves as a more current illustration. The first Pan-African CDC is this flagship initiative, unveiled in China in 2018 at the Forum on China-Africa Cooperation. According to its official website, it will improve the ability of African nations to detect, prevent, control and respond quickly and effectively to disease threats. More than just a lofty pledge, President Xi Jinping's vow to provide 60 years of medical help to Africa is a tangible example of honesty, tangible progress, goodwill, and amity. This commitment was made during his first trip to Africa 10 years ago. These norms still govern the interaction between China and its African partners. China's engagement with Africa can be considered a natural extension of its time-tested approach to domestic development. It emphasizes future-focused, people-centered, and implementation-driven development, which is essential for launching modernization processes. China has set a long-term aim of modernizing by the middle of the century, which broadly coincides with Africa's timeline for reaching its development goals by 2063. Cooperation in various areas, including public health, will likely pick up steam in the coming years.